Many health experts say the pandemic has taken a toll on Ontarians' mental health, putting additional strain on already limited resources. Now, with Election Day just over 2 weeks away, major party leaders are pledging to do more to help those in need. Let's bring in our Maleeha Sheikh with a look at some of those promises tonight. Maleeha.
Melissa, advocates we spoke to say mental health is a nonpartisan issue, but they are closely watching to see what each Ontario political party is promising if they are elected. We take a close look at what those changes are and why they are needed.
We have a lot more people who need service than we have capacity to serve. And unfortunately, that's been the case before the pandemic. And I think the pandemic really exacerbated that fact.
The CEO of the Canadian Mental Health Association's Ontario division says while she's glad to see political parties release their mental health platforms, she has a lot of questions.
What's a little worrisome is the specificity around what they plan to do. So my colleagues across the province haven't had an increase to their base budgets, the ability to manage their operations in several years.
The NDP is promising to establish universal mental health coverage so Ontarians can use their OHIP card instead of their credit card.
Prevention is key. Many people who need the therapy, the treatment, need to get it early. And we want to ensure that we're expanding psychotherapy services to be included in our mental health care plan, cognitive behavioral therapy, which we know many kids need access to.
The NDP is also planning to invest $130 million over 3 years in children's mental health, boost funding to Canadian Mental Health Association branches by 8%, and invest $10 million more in mobile crisis services, among other initiatives. The Liberals are also promising big investments to the tune of $3 billion and expanded OHIP coverage.
We also are going to make it possible for workers to have access to a portable workplace benefit that they can use to access mental health services no matter where they work. We are committing to hiring 1,000 more mental health workers in schools to help our kids and to give them the support they need to recover from the difficulty that these last 2 years have been for them.
The Green Party is promising to build 60,000 supportive homes with wraparound mental health and addiction services over 10 years and get more services covered under OHIP.
Expand services that are available through OHIP, so people can afford to get the care they need when and where they need it. Secondly, is a firm financial commitment to reduce youth wait times to access mental health services. Right now, 28,000 young people are on a wait list that's an average of 18 months long, can be as long as 2.5 years.
CMHA's CEO says while getting OHIP to cover more mental health services sounds great, she's uncertain of how it will work.
I think there needs to be a fair bit of understanding of what that actually looks like and where the individuals that would begin to perform these services would come from, because we don't really have a lot of people who are skilled to be able to provide those services as yet.
Yeah, come on in here, man.
Meanwhile, the Conservatives tell CityNews their plan includes $3.8 billion towards addressing the mental health and addiction needs of all Ontarians, $204 million in net new annualized funding to expand services, which includes funding for 4 new mobile mental health clinics to serve remote, rural, and unserved or underserved regions, as well as $132 million in pandemic funding for mental health and addiction services. The CMHA CEO says she also finds Bill 124 problematic because it caps the salaries of many healthcare workers. She says she wants to see higher paying jobs in the mental health sector in order to recruit and retain staff.